Walking into JeffHOPE and medical school, I didn't know much about individuals experiencing homelessness, and now when you say homeless, I don't think of any person. Homelessness doesn't look like any one particular thing. JeffHOPE is a group of student-run free medical clinics that operates under the guidance of Jefferson's Department of Family and Community Medicine. And our goal is to provide acute medical care when it's appropriate, but more importantly, to get folks hooked into doctor's offices, health insurance, and other social resources in the city that are better equipped to care for them long-term than we are.
This was the early 90s, and street homelessness was increasing in Philadelphia and was prevalent and visible right around our campus.
And a few students said, I'm walking out of the dorm and I'm tripping over people. What the heck can we do about that? So we ended up working with Project Home and Sister Mary Scullion, who invited us to join her in West Philly, where she had befriended a group of veterans. She said, they're in pretty bad shape and I don't know what to do about that. Can you help us out?
We got everything ready, we had our stethoscopes, we had charts made up and forms, and we waited and waited and waited, and no one came. It was the first of many ongoing lessons in humility for JeffHOPE.
The biggest challenge was gaining the trust of the men that we were visiting.
Dr. Plum said, we're gonna sit down with these guys. We're gonna play cards, checkers, introduce ourselves.
You're on their turf. You're listening to their stories. And you become much more aware of the challenges that people are facing in their daily lives.
I know the names of all those guys. They're burned into my brain because they were my first patients.
The students developed rapport with folks that you can't develop in the confines of an examining room.
The ability to develop a relationship, just a relationship, to me, that's like why I do family medicine.
The vast majority of our students, with no requirement from the dean's office, choose to spend time at JeffHOPE.
If you want to really learn a lot from the community and from the individuals staying at these shelters, and again, it's a very delicate learning experience, but there is so much that they can teach you about themselves, about yourself, about Philadelphia, about the healthcare system, about the social and medical issues surrounding homelessness and surrounding poverty in this city.
What are the human traits that we need to cultivate in our medical students so they be the kinds of physicians that function at the highest humane level? I know of no better way than taking students out of the comfort zones of the walls of our institution and putting them into our communities.
People struggling with these issues in the community are the greatest teachers. It's very, very different in the neighborhoods and the shelters and the streets than it is at 10th and Walnut.
The Philadelphia healthcare landscape looks a lot different now than it did in the early 90s, when JeffHOPE first got started.
The students are recognizing that the system is more open to the challenges, but still has a ways to go.
If you were in a community that you weren't from, you may think you were doing a better job than you really were. For me, being from Philly, and going out to learn about service and try to offer service to people in Philadelphia, it forces you to confront the inequalities and the realities of what people are facing and the limits to your own power to make change.
We all could be more proactive than we are now, and trying to figure that out, who to partner with, where to use our leverage with legislators, policymakers, in making change.
Over the last 20 or 30 years, there's been an incredible commoditization of medicine. What we have is assembly line medicine, and we really need an antidote to that.
In this country, we still don't recognize health as a human right. So anything we can do to help the students learn a little bit about access to care and how basic that is a critical lesson that seems to be overlooked.
There's a social science to medicine that I think JeffHOPE has allowed folks to experience.
It makes me want to understand people better and get to a mutual understanding that I think is going to help me treat them better as their physician.
Bright kids, generous kids, service-minded kids have basically a morality or a moral obligation to make things better. And that's what we're trying to do. Without Jeff Hope, I think the institution would lose part of its soul.
On the occasion of this 25th anniversary, Jeff Hope, a really big thank you to the founders of Jeff Hope, who had the drive, the creativity, and the incredible commitment over so many years to turn it into what it has become.
I'd like to thank the men of the St. Columba's Safe Haven who were generous enough to become our first patients at Jeff Hope, who were wise enough to share their life experiences with us and help us learn what it truly meant to try and help someone in health and healing.
I'd like to thank the hundreds of residents and faculty who have volunteered their time to go out on evenings and Saturdays to mentor students, help them take the best care of people that they can.
There's people out there who are so grateful for the work Jeff Hope does in so many ways, and that's because there are students and residents and physicians and administrators who are all in this together, and we need everyone. We need all of those pieces for Jeff Hope to keep being what it's been for 25 years and to grow even further in the next 25 years.